Medicare of the first round of North Dakota Medicaid Academy sessions. We're talking to Monica and Jennifer about how we help support your agencies going forward from this. We know we've got other agencies that want to go through this process, et cetera. But thank you all for spending the last 6 weeks with us. And we have one last session today on ensuring quality services. And then we will also have the Q&A on Friday, though I won't be on that. Ambrosia will be covering that for me. All right, so next slide, please. I just ramble here into the void. So yeah, so today's facilitator, same as always, this is your CSH team. My name is Marcella McGuire. I lead our health and housing work nationwide, and I'm based out of Philadelphia. And Ambrosia, I'll let you say hi to everybody.
Surprise, it's still us.
Exactly,
Hi,
exactly.
everyone. My name is Ambrosia Crump. I'm a senior program manager in the National Consulting Healthcare side for CSH. Background is in homeless systems and in behavioral health and outpatient care settings as well. Happy to be here to wrap up our Medicaid Academy.
All right, thanks. So next slide, please. So the team we asked you to bring today is your program lead. This is the folks who's doing direct service, doing the direct service, supervising people who are doing direct service, and then who in your office as an agency is thinking about quality. What's the quality perspective? And that's going to be, we're going to be talking about their fundamental role, but obviously there's a real, overlap between the program, the quality people try to make sure the program people are doing quality. So we wanted to have both of you here because quality is really a all agency and team effort. Next slide, please. So we're at the end of our schedule here. You'll see our dates, you'll see our tools. Quality assurance is today's conversation on September 7th. And we are in the midst of developing, once we get past this academy, we're going to be developing some of those tools. I believe Ambrosia's already shared with everybody the tools that we've already developed as part of another project, but those are all housing support related. Lots of really good information in there, policy procedures and things, but we want to do something, but we'll be working on the next couple of months on adapting those tools so they really affect and they are relevant to all of the services that are offered through your 1959. So maybe you're doing health support, maybe you're not, maybe you're doing peer support, maybe you're doing training for family caregivers, maybe you're doing respite, maybe you're doing benefits navigation. We want to make sure that all of those are covered in all of these materials. So that is our schedule, and we'll be doing, I believe, unless Monica says otherwise, I believe we're going to be doing 2 more rounds of this with other providers as well. Oh, hi, Shanika. Thank you. I love seeing you guys. Yeah, please say hi there. So again, purpose of the Medicaid Academy session, Department of Human Services, Monica and Jennifer here and their teams provide the what of policy requirements. And then the TA team, we're here to help you with the how. So think about if we're going to fulfill the requirements that the state has put forward for the program, then this is what we need to do as an agency. There'll be tips and tools, there'll be opportunities to share, folks are ready to talk and chat us up here, and then also coaching and support for your agency. You'll have breakout rooms and breakout times where you and your agency could talk about your work plan. Hopefully agencies have been putting out the work plan, building out their work plan that we give you a template for in the beginning. You don't expect, nobody is going to get all of this right away. All of these recordings are going to go up on the state website. You're going to have them to reference and go back to, but it really helps to have that, even just a high level work plan to kind of organize your work going forward. And we've got the state's website for the 1915I and the actual state plan amendment. We'll be seeing some quotes from that today as well. So next slide, please. Really valuable websites. So what's impacted at your agency level? We've seen this slide before. Spend some time thinking about each of these lenses separately, programmatically. What do we do? How do we interact with the people we're serving? How do we support them to reach their goals of their person-centered plan? How do we support our staff and train them so that they're direct services staff, so that they're impactful with the work that they're doing with the people that we're serving? Strategic, what partnerships do we need? What are we good at? What are we weak at? We may need new partners to help us in the places where we're weaker. And think about how we're growing our business and how we're growing our agency long term. There's analytical conversations, data management, what data you need, quality assurance, which is a big part of today's conversation. And then finally, just logistic. How do we all do it? If we have the program down and we have the strategic vision and we have the data that we need, how do we pull it all together in order to make it happen? From a fiscal point of view, from a program point of view, from a staffing point of view. And we'll hear also, here's a new word for today, from a compliance point of view, because there's a significant compliance requirements to most Medicaid programs. And it always helps to have somebody with that label in there. If you don't have a full-time compliance officer, you're not big enough, big enough an agency for that. Somebody needs to be thinking with that compliance lens. So next slide, please. So share tools, we said, as I said a little earlier, all this is going to go up on the website here, Medicaid Academy Training and Tools location. We'll have the recordings, we'll have the slide decks, we'll have the tools. We've got some QI plans and examples and some templates for you today. Again, these are just things for you to download. Much easier, in my experience, much easier to start from somebody else's example than really starting from scratch. This is what we've gathered from some of our best practice work. Take it, grab it, take out our logo, put in your logo, adapt it. It's all here for you to be able to make putting all of this in place easier for you all. So next slide, please. And I don't know if the slide decks, I know Ambrosia has been sending out at the end of the week the slide decks and any tools that we have. I don't know, and maybe Monica or Jennifer can put in the chat if we've been able to get any of that up on the Medicaid Academy Tools and Training location on the state website, or if there's any timelines for that.
Yeah, I'm still working on that. I put in the chat that we actually merged with the Department of Health, and that brings a new website for us. I have made the request for all those recordings to be on there, but they're not there yet as far as I know. They have to be converted to our YouTube channel first and then put it's a several-hour process. But yes, they definitely will be on our new website. Yeah.
Monica, the links that we put up here for everything, we pulled those together in the last month or so. With shift to the new website, are we going to need to go back and re-put those links there? Will the links still be good, or will they redirect you?
The links in this presentation for session 6, I updated all of them.
Oh, awesome. Okay, but we still need to do for 1 through 5.
Yeah.
Okay.
So we'll work on getting that done, and then yeah.
Okay, great. And you can always email Ambrosia or myself and ask us. We've got all of these decks, and we can get that to you as well. But I know ultimately we would definitely want it up on the state website. All right, thank you, and thank you for all those efforts. And Ambrosia, please remind me later. Make sure we all do that, because she knows I'll forget. Because I'm talking, I'm not writing down my notes to remind myself. All right. Next slide, please. All right. So what are the key takeaways? What do we want you to, come away from this thinking, okay, I learned this today. We want to talk about the difference between a quality program and a compliant program, and how that's important, and how it's important to have times that your team is thinking about it from a quality lens, and it's important to have your team think about it also at times from a compliance lens. We want to understand the effective elements and the pieces of quality improvement planning, quality assurance. And really, we think about quality is often seen as a static process. Quality improvement is seen as a constantly iterative process, meaning you're always growing, you're always learning, you're at your baseline now, but you're going to be better next year. And 2 years from now, you're going to be twice as better, et cetera. So we really want you to help think through how you integrate that into an annual schedule and annual processes to make sure you're always improving the quality. We want to understand the need of development of quality standards, and how your agency works to build. This is what you will do in order to ensure quality for your agency. That's integrated into your policies and procedures. That's integrated into your onboarding for your staff as they begin. So everybody really sees quality service as their business. And then also talk about what data you need to collect. This is the data lens, the analytic lens. What do you measure outcomes as you're looking for funding, both from the Medicaid side, but also from grants and philanthropy and other funders, et cetera? You want to be able to tell a story. You want to be able to say, this is the difference we've made in people's lives. This is how we've helped people achieve stability, achieve, community integration, achieve thriving, be where they want to be in there, not be institutionalized, not be experiencing homelessness. So what are the stories that you want to tell about that, and what data and information do you need to capture in order to be able to tell that story? So we'll talk about ways in which you go through that as well. So these are just some key takeaways from today's session. And next slide, please. So we want to have in the chat, everybody just put in something about how ensure and share how your agency ensures quality of services. What different quality activities do different agencies have here? So if folks want to, we're just, what are we, like 24 people? If somebody wants to get off mute and talk about this for us, or if somebody wants to put in the chat, what work does your agency do to ensure quality? Satisfaction surveys, chart audits, quality audits. Yep, we've got examples of those we can share for agencies that don't have what Candia's agency already has. Client surveys, focus groups. These are all great ways. And what's really central to all of them is hearing the voice of the people you're serving. You know, giving them a place to share information, giving them a place to share whether they've gotten what they needed and how to really have a dialogue with you about what services and what supports they need. Stakeholder surveys, program quality audits, all things. If anybody's got any examples of any of these tools, et cetera, and they're good to share it, please share it with Ambrosia and I, and a link to anything that's online. We'd be happy to share it with, you know, links to that under this slide as well, so that other people can gain from your experience as well. Make sure it's a PDF, make sure it's got your logo on it. I want to make sure folks know that we are getting out, as I say, that we are, you know, recognizing your work in order to put that together. That's really important. Protecting your intellectual property is what we say. So next slide, please. Thank you for that. Surveys, focus groups, always helpful. So the first thing we said we're going to talk about is compliance versus quality. And often agencies have the same person working on this, but it's really important to have separate activities, separate, it doesn't have to be separate staff, but separate efforts and separate reporting to management and leadership and your board and your stakeholders. That compliance is, did I follow all the rules? You know, compliance is, did I dot my I's and cross my T's? There's these regulations in place. Did I follow them? Requirements? Am I documenting? Are my staff documenting the way they need to do? Is there a clear line from the person-centered plan, we like to call the golden thread, from the person-centered plan to the service plan to the activities that my staff are doing with the individual? Are the individuals reading their goals? If they're not meeting their goals, how are we, you know, have their goals changed, or are we revising what we're doing in order to help people meet their goals? You know, is that golden thread there in place? Could we pass an audit with flying colors? That's compliance. Quality is a really separate concept. Quality is, are people getting the help that they need? And there's certainly overlap between quality and compliance. You know, are people able to thrive in the communities? Are people able to be integrated? Are people able to stay out of institutions, stay out of incarceration, stay out of nursing home facilities? Are people getting the help they need? I mean, it's really that basic and that simple, but that's what you do to ensure quality. And that's why in all of the quality examples I think people had, there was a lot of, here's where we collect information from the people we serve through client surveys, through satisfaction surveys, through focus groups, one-on-one conversations, program quality audits, a separate audit that's really focused on quality, and really look at that compliance lens at some times and the quality lens at other times. I've seen agencies focus on, you know, for the first 6 months of a year, we're going to focus on quality, you know, and look at the charts and support the staff, et cetera. And then the second half of the year, we're going to focus on compliance. And everybody knows that. Everybody knows it's coming around in the calendar, and it's something that they can look on. And it shows both are important to the agency. But both require their own lens, if you will, their own time to consider that, et cetera. So we want you to make that clear distinction between compliance, I'm following all the rules, auditors will be happy with me, and quality, I'm really making the difference in the lives of the people that we're all here to serve. And we'll talk about different activities to support each of those. So next slide, please. So we're going to talk to start with North Dakota's commitment to quality. And I make that distinction between quality and compliance because in the state plan amendment, it's often really kind of linked. It's all kind of comes under quality. But the reality is a lot of it is really compliance focused. So I want to focus on what the state said that they were going to. Remember, Medicaid is a joint program between the state and the federal government, or the Center for Medicaid and Medicare Services, et cetera. So this is what the state's already committed to doing in regard to quality improvement. They want to make sure that all plans of care address all needs of the 1915I participants. The state's going to do audits. I don't know if they're going to be annual, but they'll be coming and looking at charts, and they'll be looking at these things. I can promise you the state is going to do this. I can't tell you when, but I can tell you going to do it because it's what's in publicly facing documents, and it's what they promised the feds that they would do. So I promise you that's going to happen. Next slide, please. So, and starting on page 139, okay, this is it all. So quality improvement, quality assurance. Plan of care is updated annually and reflects the client's choice. I will tell you a lot of times as you look at how things are written in plans of care, it's really supposed to reflect the client voice. I don't know any normal person who has ever said, I intend to be medication compliant for my long term. That's how we speak. That's not how real people speak. So they really want to see something that says that this is really the voice of the people that you're working with. The state's committed to be compliant around eligibility requirements. They're going to have the eligibility evaluation that we talked about in session 2. That's going to be done. It's going to be reassessed on an annual basis as is committed to. The process, all the processes is going to be applied as directed in the state plan amendment and as they did in the first, and they'll relook at individuals' need for enrollment annually. It's important to know that services aren't going to end when that annual enrollment comes up. You just have to give the state an update. Here's how the individual I'm working is doing. Here's goals they've met. Here's goals they haven't. Here's how, we really think these services may or may not be needed for them to continue to reach their goals and to continue to and continue living in the community in a most community integrated setting possible. Again, that's our speak. That's not client speak, but it's really, really helpful. It's the kind of thing that the state's going to be looking for in these audits. States providers are going to be required qualifications. You prove all of your provider qualifications in the provider enrollment process. That's going to be required, but they're going to ask you in audits to look at these things and see if they're there. We're going to want to make sure that individuals reside in settings that meet the HCBS final requirement. What does that mean? That means that in a place where someone has their own place, they've clearly made a choice, they're living with family, they have a lease, you should be fine. If they are enrolled in a provider controlled setting, notice I say controlled, not just owned, but controlled setting, then that is a setting that, using HCBS terms, requires heightened scrutiny, meaning they want to be sure that the person really had choice about where they are living. HCBS is all about keeping people out of institutions and letting them live in the places of their choice in the community. So the state's going to make sure that that choice is evident, and that's evident in your documentation. The state has an oversight role and responsibility for the program. They maintain financial accountability, and the state identifies and addresses and works to prevent any incidences of fraud, abuse, or neglect. So that's what the state's committed to the federal government that they're going to do on a regular basis. A big piece of that is state-related activities, but a lot of that is them auditing or reviewing your activities as well. I know you're not feeling well, Monica, but if you want to come off mute and say anything about this as well and how the state's going to be looking at this, again, this is all taken from the SPA, so I'm sure there.
Yeah, actually, I mean, what I would really have to say is that some of our providers have already been through this process. So what
Good.
this is going to look like is just, I think it's going to be every spring, like at end of April, maybe, where we're going to have some reports that providers will need to complete for us and send in. And it just kind of goes over the requirements of the providers. And that includes like what the trainings that they've had and documentation that they've had the trainings and documentation that there's policy and procedure in place and those types of things. They're the same. It's the reports that we shared a couple weeks back. That document that showed, when we were talking about policy and procedure and what were non-negotiables. Yeah, those are exactly what the forms are that we use for this process.
That's great. That's great. Yeah. And Ambrosia, make a note. We probably want to get, are those forms online? We're going to want to probably link to them here.
Well, they're going to change a little bit every year.
Okay.
So I can, I've shared the ones that we used last year, and
Yep.
we'll work on tweaking the ones for this year. And, the idea will be that, they'll be available for anybody who wants to review them. Yeah.
Good. Good. Yeah. That sounds good. It's always good to know when you're about to have one of those kinds of visits, audit like visit, etc. What it is I'm going to be auditing. What are they going to be looking for? That's always really helpful. And I do think the old forms are helpful as well. In lieu of the new forms being in place, I think that can be helpful to people because they can start to, look through their materials and make sure, what we're being audited on may change, but it won't change so much that, it wouldn't help them prepare. Yeah, I think that's probably true. Help them prepare because I think that's important. All right. So those are the things that the state has committed to the feds in order that we promise that we're going to do. As I said, this financial accountability, that's the state, that probably doesn't have much to do with you, but a lot of these other things, plans of care, client choice, HCBS settings, all of these are going to be things that the state's going to be looking for evidence of in your charts, in your documentation, and in your review, and in discussions with your residents or clients as well. All right, so next slide, please. So commitment to quality, we really think at CSH of commitment to quality as an ongoing process. It's not something that's one and done. It's not something even that once a year is done. It's something that is a part of your training. It is a part of your onboarding. It is a part of something that happens every day. And it's really a part of each of you are leaders in your program and you would be part of this conversation. It's also a part of the example you set for all of the staff that you work with. And what are your priorities? What's important to you? How do you ensure that people are getting the services that they need in order to engage in their recovery, in order to support their lives in the community? And how do you make sure that there's an ongoing commitment to quality? I love Ambrosia's point. We can be compliant and not have quality services, et cetera. And you can have quality services and not be compliant. Both are really important. They're really important. Such a good point. Next slide, please. So here's an example of one of CSH's client satisfaction services that we've done. One, you ask people, are they satisfied? Most people answer that one yes, and you have to say, get to more detail. Do you see your worker frequently enough? Do you talk about the things you want to talk about? Do you want to break it down into something more detail. You want to talk about quality of life, and we've got examples of quality of life surveys we're happy to share that talk about whether that's helpful. And then who's satisfied? Are they satisfied with their service provider? Are they satisfied with the agency? Are they satisfied with the people that are working for in a year or more over time? These are things that you maybe want to give at different times of the year, different places, et cetera, and get just a good sample and get feedback on how you're doing as an agency. At the end of the day, the outcome is participant satisfaction, and the outcome is also the participants understanding that you're always looking to improve. You're always looking to engage with them. You're always looking as possible to hear their voice. And you're always looking to sort of lift up that data and say, here's where we're doing great. Let's celebrate that. Here's where we have room for improvement. We all have room for improvement everywhere, every time, somewhere. Nobody is perfect at any of these services. It's constantly an evolving process. And so we really want you to think through how to do that quality service for your agency over time and each time, and that ongoing commitment to quality services. So next slide, please. So here's the questions we want you to ask. Here's the questions that we want you to figure out here. Audit, who does the audit? When do they do it? We just heard some of that. So it happens in spring, and the state will be developing tools. That says to me that somewhere on my work plan, my annual work plan in winter, I need to be doing my own internal quality audit to make sure that when the state comes in spring, that charts are in the order that we need them to be in, that staff really understand the links between the person-centered plan and the service plan and the activities that we're doing with people, that my documentation is compliant, and that you've given surveys. Maybe you do a lot of your quality surveying in maybe the fall and the early winter to hear from the state, hear from your people you're serving, so that you have reports to that. So when the state says, what are you doing to ensure quality? You have your satisfaction surveys, you have your write-ups from focus groups, things that you can share so that you can show your commitment to quality as well. So that's really helpful to get when the state's doing it and thinking of that. I think that helps you plan sort of your annual calendar and where are you in the cycle in any given day. You may want to have your own quality standards. These are some examples I said of what the state's committed to, but what do you want? How do you ensure quality? And how do you engage the people you're serving and say, how do we know that we're delivering a quality service? How do you know? How do we, that's a dialogue, that's a conversation. Are there any other standards that you want to set and put in place? You would put those in your policies, procedures manuals, would review them probably on an annual basis. And you do regular report out. Again, that's something that funders really like to see. Grant funders, philanthropy, et cetera, would love to see is that commitment to quality and all the activities you're doing to ensure that commitment to quality. And if you want to develop other standards, how do you do that? Is that done with the participants? Is that done with their family members? Is that done with other? My guess is you're going to be working with different, because you're working with folks with behavioral health issues, you're going to be working with other behavioral health providers that are delivering more clinical and clinic-based services. How do you have a conversation with them about how you all work together to be a team to support this individual in the community? So think about what other stakeholders you need to engage. Think about what other stakeholders you need to engage as you're looking at the services. What are the needs in your community? Maybe you've decided you're going to offer benefits navigation and peer support, but you also want to have conversations with churches in your community, with the food pantries, et cetera. What other services do people need here? What's the potential for me to grow my business doing more of these 1959 services? So that's another piece that we talk about when it comes to stakeholder engagement. So all of these things to think about, put on your work plan, consider when it is you do that, when you reach out, when you think about who do I talk to about this? All just a way, again, the work plan is just a way to kind of keep yourself organized. There are many, many moving pieces to any given Medicaid program. You may have different people who do different pieces of this. If you're a larger agency, it may all be on one or two of you. If you're a smaller agency, but again, you want to be able to think through what that opportunities are, write it down and be able to check it off your to-do list. All right, until it comes around again, then schedule next year. So with that, I think, next slide, please. I think am I right? Ambrosia, do we have a break next?
We do have a
Yep.
break.
Okay, that sounds good. So let's come back and at about 20 of 1. I'm sorry, yeah, 20 of 1, so 12:20, etc. We'll take a little break here and we have another set of slides where we talk more about quality because it's a lot about compliance. All right, so we will see you at 20 minutes before the hour. And any questions, always feel free to drop them in the chat as well.
1 minute. Welcome back, everyone. Hopefully you guys took a chance to reset, get a bio break, grab some coffee, or even in some of you guys' cases, maybe even some snacks for lunch. I know we're in the middle of that time. I don't know if a lot of us are using this as a lunch and learn, but hopefully you feel a little better and are back in your seat and ready to continue with us as we talk about quality assurance, quality improvement. So how do we make sure that we are doing well when it comes to quality improvement and compliance outside of like what maybe a stakeholder like a state tells us or another funding source tells us, right? So having a plan helps us to figure that out. So we'll talk about what that means as far as why it's important. So we know, of course, the state is going to be evaluating us annually on our practices. So we want to make sure we're compliant. But that's not the only reason why we care, right? Other than the funding requirements, whether it's the state or other grants or funding sources, and the fact that it's required. This slide really just talks about altogether maybe some other reasons why we should care about quality improvement. And so, as Marcella mentioned earlier, quality improvement is all infused into the way we do our work ideally, right? So that means that if we're working and striving towards being better all the time, the feedback loop we get when we get the data back from some of those endeavors that some of you guys talked about, like doing focus groups, doing surveys, reaching out to stakeholders for input and solicitation. As we get that data back in, we should see improvements in our policies and procedures, right? Because we're supposed to use that and make adjustments accordingly. And then we should maybe be changing how we deliver our services sometimes, or making some improvements on our procedures. And that leads to improvements in our programming. And then that should hopefully give us better outcomes, right? People will get better services from us. And then, as you guys, I'm sure a lot of you know, depending on what work you've done before, if you've pursued grants historically, as opposed to like the 1959 waiver we're looking at now, one of the big questions we always see on those grant applications is, how do we know you guys are doing great? And if we have a plan in place, we can speak to that. This is our plan to measure that. This is our plan to ensure that that is a process that is ongoing and continuous throughout our agency. So that helps us with grants and funding if we have a quality improvement plan in place, and we're doing that work throughout all of the efforts that we do, whether it's developing a new project, whether it's creating policies and procedures, and delivering the services themselves. Quality improvement should be at the forefront, and that's why we should care. So what should we be wanting to see in a quality improvement program? So we have to consider how we're keeping documentation, right? So this bleeds into all the other sessions we talked about. We talked about EHRs and HIPAA compliance, and how we have to make sure our documentation is in alignment for billing opportunities. So we have all these other reasons we care about documentation. But we also want to make sure that quality improvement is at the forefront of our mind too, when we think about how we store our records, who has access to those records, who is going to be doing file reviews, right? So, and we'll talk more about what we're talking about when it comes to reviewing files internally for preparation for external audits, what's listed here now. So thinking about what we're developing and where we're keeping things, who has the access to it, who's helping to ensure that we are maintaining quality. When we say the who, we mean who at your organization. I know that some of us wear lots of hats. So if this is just a new hat you're putting on and you're just thinking differently, that's important to know, right? And to put that hat on today. If it's another person that we're identifying in this role, then they need to be clear about, what is the process that they should be following. And then we should be seeing continuous quality improvement. So how are we not just preparing for the big audit, but what are we doing to inform us ongoing? and to ensure that the work that we're doing meets and maybe even exceeds our goals or for the reason why we got to the work. And so we want to develop a quality improvement plan. So here at the bottom, I know if you click on it in the Zoom link, it's not going to do anything, but when we send you the PowerPoint, there'll be a link, right? And so it just has an outline of maybe what the heading should be there when it comes to writing out your quality improvement plan if you don't have one already, and what you should be considering as far as activities that you should be doing, again, regularly and ongoing to ensure quality services. So let's just talk about some of these here. So the reviews, where are client files being kept? How do we know that we're in compliance with the billing requirements that we've already gone over in session 5, and in particular Medicaid compliance? Monica touched on that. How do we know that our services are being targeted? How are we making sure that the reviews are targeted in a way and planned in a way that ensures that it's a good measure, it's a good data source for what we're trying to evaluate, right? So we're not just picking one case manager's files to review, that we're being equitable in collecting a full picture of all of our organization's processes and work, and that if anyone were to come behind us and do that same thing, they would hopefully get consistent outcomes as far as what our quality is, where we stand with quality, and what we're doing as far as service delivery. When it comes to program staff, program and quality assurance staff responsibilities, we have that here. We talked about, you might be wearing this hat, maybe you're identifying someone internally who's doing this work. Your quality improvement plan should outline what should they be doing. Who is a quality improvement manager? What does it mean to be one? What activities should we be doing? So that could be, again, you'll want to have a broad description in your quality improvement plan, but we'll talk through like maybe activities a little further down. And then again, the outline kind of informs a little bit of what you might ask this person to do. It may be that they're the one assigning files for peer review, right? So you may say, okay, leadership is going to do reviews of files, but maybe we'll also incorporate a practice where peers are reviewing each other's files and giving feedback. And so who's going to oversee that? Who's going to sign that all out, right? So that might be an example of what a quality improvement manager's role would be, is to facilitate that process. Your program outcomes. It's important to talk to your program staff about what you'd want to see and what you're measuring and why. So they have an idea of what they would like to be delivering to, right? If they're not kept in the loop around what it means to us as far as delivering quality, how do they adhere to the policies and procedures in a way that makes sense for them too, right? So they should be a part of this process. They should know what the standards are and why, and then they should also have a means to inform that. That could be, we talked about client satisfaction surveys, but you may want to consider doing some internal staff focus groups, internal staff surveying of how they perceive the work being done, and if it's to the standard that everyone is hoping it is. That is going to help inform the process too, but again, how do they know that if they're not part of your process to develop and inform your quality improvement plan? And to really know within the plan what the standard is if they were to pick this document up and read it. We've also talked throughout our other sessions around staff training plans, but we have to remember that they're the gatekeeper of the work that we do, right? When the client comes to us for services, they're either the first person or one of the first people that they interface with. So do the staff know what the expectations are for delivery of services? And so in the quality improvement plan, you should have, what is our staff training plan to ensure that they know how to document, that they know how to bill correctly, that they know some of the evidence-based practice models that we're supposed to be using, and we have proof that they have access to training for that if someone were to ask us for records to show that. How does our quality improvement plan outline what the training plan is for staff so that someone could go back and reference that information and say, okay, we planned at 30 days, all staff will have this. At 60 days, they'll have that, and et cetera. So your quality improvement plan may outline what the normal training plan would be, ideally, right, for your staff that you're onboarding to ensure the quality services. And then what's the process for reviewing policy and procedure, right? So we're continuously engaging in a feedback process with our clients, with stakeholders, with our staff, and we're getting input, we're getting data coming in. What's our process for reviewing our policies and procedures? Is that going to happen annually? Is that going to happen upon an incident or an event? and then who's the person that is in charge of facilitating that review process. So keeping that in mind as far as developing your quality improvement plan, who is going to be the keeper of that, how that process should be outlined, and when those activities are going to occur, so that you can ensure this is always ongoing. And we talked again about client satisfaction surveys. Are we going to do focus groups? Are you going to deliver surveys site-based? Are you going to have them handed off by staff members? Even surveying when, the frequency, how you're going to do it, if there's going to be a variety in capturing that that information or soliciting input from our clients. That needs to be outlined in our quality improvement plan too, so that staff who fill those shoes when people rotate out of positions know how to deliver this process in a consistent way. And again, we want you to check out that outline, because that should be pretty helpful if you don't already have a quality improvement plan, as far as like the skeleton or bones, to start writing out what you want to have happen every day. So we have an organization, right? Or maybe we have some programs that we're starting to onboard for the first time through this 1959 waiver. And we feel really good about what we're going to do as far as the theory of making sure that the services are great. So we have our theories. We know that we got great training lined up. We may ourselves be subject matter experts in some of these spaces, and we're just getting our toe wet in this particular funding source, and as we're just expanding. So maybe the theory is great, right? But now we're taking everything we wrote. We even maybe have a quality improvement plan so that we make sure that we're ongoing doing good work, but we have to now figure out how to walk that out on a regular basis. And that is the taking theory into practice. And specifically, we need to think about, when we're planning for quality improvement, some of the impact that it has to our staffing and how we're going to provide supervision. So some examples may be where we're thinking about the folks we're hiring for expertise and skill level. If this is a new service for us, if we're expanding and we need to find more staff, it may not just mean finding staff who have the clinical background, because billing may be new to our agency, or we're doing things differently, and now our documentation needs to reflect that. The expertise that we might need to be seeking may be folks who have experience in documentation and billing Medicaid. And for some folks, if we're not finding new people, but we're going to be training and learning this new resource, maybe we need to develop a learning space for learning to document and bill, right? So maybe we have that clinical stuff down and we're ready to go, but this new area of billing Medicaid, we need to build in space for folks to learn how to document, to learn how to submit billing so that we can get our funding in. And that's going to ensure quality services, right? If people know how to do those things well. So we need to build in for that learning curve. And then just understanding maybe licensure requirements. I know for each service, we have a policy outline and what the qualifications need to be for respective staff for those services. So making sure that we're hiring to that, right? For example, if someone needs to be a QMHP, if they need to have a specific experience in substance use, we need to ensure that the staff we're hiring can meet the standards that are outlined in the services policy that we have for our North Dakota Medicaid 1959 waiver. So that's important to know. One of the things that folks may not have considered too sometimes is when we're building a caseload size, right? So we have caseload size here. Now that we have Medicaid, with Medicaid comes maybe more paperwork. So the way we've delivered services may have to change, even if the service on our end seems the same. We may have to consider adjusting caseload size just to make space for time to document, time to bill, time to record keep accordingly in a way that we've never had to before. So just thinking through those things and what you'll in the training that needs to happen too, right? How do we build out the caseloads for folks who are onboarding when they're also being trained on a lot of new things, or people who are seasoned but also need to take these trainings that we just talked about. And what about supervision, right? So considering too that depending on the services that you have, you may or may not need particular licensures for certain supervisors. If it's a clinical practice, they may have to have clinical licensure, right? If we're doing something like peer support, maybe it's important that their supervision is in place, that is experienced in that. And how do we talk about like boundaries? How do we talk about service delivery in a way that's equitable? And folks who have experience in delivering peer services, if this is a new service for us, may be important, and we may need to outsource that if we don't have it internal to our agency. So how are we going to provide supervision for folks in these specific service areas if this is new to us? Also, we talked again about training. So there's clinical training, and then there's the intricacies that we've been trying to dig through with when it comes to Medicaid billing and documentation. And then thinking about, like, we talked about the quality improvement plan and making sure that there's a feedback loop, and some of that may be internal auditing and pulling charts and reviewing that. So it may mean that the supervisor may need to have training on how to do that if they've never had to worry about this before. So we need to maybe seek some external supports to provide training and how to do an audit of a chart, and how do we know that, and how to document the outcomes of that audit, right? So this may be a new area for some of our organizations who are getting into the Medicaid space. The other thing we want to keep in mind is stakeholder input, and Marcella talked to this a little bit earlier on when we said who are we engaging with when it comes to like faith-based communities, food pantries, folks that we are normally working with but may not have considered that their feedback affects maybe our policies and procedures, and we need to formalize that process. So I kind of want to let you guys talk to me at this stage. You guys are allowed to talk in training, believe it or not. So if you're okay with coming off mute, that's okay with us. If you want to just type it in the chat, I'd like to hear from you guys. Who are some of the stakeholders that you have come to mind? What's a stakeholder for some of you guys that you're either working with or plan to work with when we're saying we need to consider stakeholder input to ensure quality services? Talked about faith-based organizations. We talked about food pantries. Those are two examples, but what are some other ones that you guys are currently working with or planning to work with who will be giving you feedback on your program? We're just going to do whatever we want. Oh no, Heather's not just going to do whatever. She has some stakeholders that she may, their organization's already interfacing with, right? The schools, other mental health providers, child welfare system. Leanne, I might need some help with your acronym for P&A.
Protection and advocacy.
Oh, yep. And we have here too family members of our clients. Technically, they're an informal stakeholder, right? The system beyond the client that we're serving, who's closely, there's social support. We have board members if you're a nonprofit or if your organization is set up corporately to where there's board members, right? They're stakeholders to give you input. Other funders, hopefully you have some diversity in your funding sources. So beyond your Medicaid 1959, your funders have some say. So here on the screen, you're just seeing some ideas on how we would collect or solicit feedback from these folks, right? You can run focus groups from some of those, with including some of those organizational stakeholders or even individuals, like people with lived expertise in this area that we're wanting to be involved with. Having some type of way to solicit feedback anonymously, whether that's a survey box, maybe a hotline they can call and share feedback, an anonymous voicemail box, right? Sending out satisfaction surveys. And I saw from earlier in the chat, a lot of us are kind of doing some of this work. What are some that are not listed here that maybe some of you guys are doing to get feedback from your stakeholders? We did a good job covering it. Bringing them donuts. No, I don't know if that's the formal way, but hosting a meeting and maybe donuts are included where they can provide you feedback in that group community level setting, right? Just some thoughts on how we solicit input from stakeholders so that we know that what we're doing is what we want to come out to. So CSH has an example in this particular instance. It's a tenant survey if you're doing like a housing support, but certainly the layout and even some of the content language can be adapted to different services for clients, right? So we have that we could share. as a resource or an example. Feel free to borrow it and change some of the language if you need to throw your logo on it, of course. But we can give you some examples of some surveys if folks are not already in the middle of doing that type of regular work. And again, it can be revised to reflect other services. So now what do we do with all the input? So we're asking our clients regularly, we're sending out surveys, we're asking staff internally, we're reaching out to stakeholders. Again, we want to put in our quality improvement plan, and then we want to walk this out every day, or not every day, but ongoing, a means to review and revise our policies and procedures. Maybe we've determined that it's not going to be just one person in the organization. Maybe we have a quality assurance committee if our organization is to that scale. And so maybe in this meeting or in this committee space, we're going to identify some action steps on how to move forward utilizing that input. And then hopefully based upon this, we might do some training that we might develop for staff internally. Maybe we're creating more resources for the client, like social activities for them or advocacy for their for that client population. And then how do we allow for people to at a less influential level to give us feedback, right? So opportunities for individuals to share their ideas with the decision makers, whether that's staff or whether those are clients that we're serving. How do we get feedback on the decision that we've made, right, before it's implemented? What else? What are some things that you guys do with the feedback you get? If some of you guys already have quality improvement plans, quality assurance plans, and a process in place, what do you actually do with everything that people share with you that we didn't already talk about? So you guys, again, are allowed to talk or chat. Well, whatever you do, make sure that people know the process so that folks can call that voicemail box if you set one up, or can fill out a survey and provide it, whether it's electronic, a physical Dropbox place, whatever it is, make it known. And then even the changes that happen, you want to make sure those are known too, so that people recognize and see that their input has influence over our systems and over our practice, right? You want to make sure that's happening. So some strategies you want to consider as far as making sure that it is a successful endeavor, our quality improvement plan. Assign or designate a staff person. We talked about this may be a hat you're putting on. There may be a point person who is following that plan and being the puppet master or being the facilitator over these processes, whether it's planning focus groups, internal audits, chart reviews, and that all levels of staff are part of that ongoing process. Again, we talked again about allowing for feedback on the new plan after we've developed a plan based on the feedback or based upon an incident that's happened. There should be a regular place for folks to come and provide that, right? So there should be a calendar of meetings, whether that's a QI committee or whether it's an informal meeting that anyone can join organizationally. There should be a calendar of meetings, whether you're meeting with yourself and you need to just put it on the calendar, hey, now it's time for me to reevaluate how we're doing, look at their surveys, look at our policies and procedures, look at this incident, and now it's my time to do that with myself. We talked about client chart reviews. So again, it would be ideal to have a planned schedule or calendar of when this is happening internally, so that you're always kept abreast of what's going on and making those pivots and corrections before the annual external audit, right? And then what's your process and timeline for reviewing policy and procedure? We talked about this in an earlier session, but making sure that we have a schedule for doing this. Is this going to be once a year? Is it going to be incident based? Is it going to be both? Is it going to be quarterly? And so how are we going to communicate that? So we want to communicate our process. We want to communicate our plan for staff internally and our expectations for staff, but we also want to be able to share our outcomes internally too, right? So how are we doing? How do folks know they're doing good work? What are the results of the chart reviews? Are you staffing that with the individuals? Are you providing an overview from an organizational level. How are you doing overall when it comes to programmatic change communication and even changes in requirements? Because staff need, if you put it in a document and save it, and folks are not directed to that, how do they know that they're supposed to change their behavior or change their process? So what's your plan for communicating that change? And then closing the loop, making sure again that especially if it's incident-based, that it's very transparent what we're doing and why we're doing, and that we're giving feedback about the outcome of the change and why that change was necessitated sometimes. So making sure we're following up with folks, especially if there's a particular trigger to make our quality improvement process push forward beyond our scheduled events. We should be sharing outcomes so folks know that their input matters and their feedback matters.
All right, this is me now. Okay, thanks, Ambrosia. I just love those really, really concrete strategies. And again, all going to be in the slide decks you get out. Don't need to memorize many of them. These are all going to be reference materials you all have. So as Ambrosia talked about, you've got like a whole bunch of different stakeholders here. You've got activities with different stakeholders. Somebody's really taken some time to really look at everything you do with a quality lens, et cetera. Continuous and quality improvement, as we said, it's an ongoing process. I found in programs I've been, it's just been really helpful to have really like a schedule so that we know, like think about it quarterly, think about it annually. I liked quarterly. Used to do a quarterly process that was act, plan, study, do. Plan is we're starting, we want to have a quality emphasis, we understand the need for compliance, etc. Let's put those pieces together. Let's add to our policies and procedures. Let's develop our screening tool. Let's develop our quality tools. Let's do all of that. Let's see who's going to do that. Let's build out that annual schedule, etc. Do is do it, execute it. Talk to your stakeholders, put up those survey boxes and gather what you've got from it there that we talked about. Take all of those pieces together and then do it. Put it together, check, report, roll it all up and say, okay, what did we learn? What themes did we learn? We heard this one little thing here that doesn't seem really relevant to us, but we also heard this other thing from 4 different times from 6 different kinds of stakeholders. Okay, that seems really relevant. This is something we really, really need to work on. That's the check. That's the reporting. And then act, make the changes that you need to do based on that, and then start your cycle again. So as I said, it was very helpful to have this from a quarterly basis. Am I in the plan quarter? Am I in the do quarter? Am I in the check quarter? Each of them feeds another in this round continuous quality loop. Big organizations usually have this already built into their practices, et cetera. So if you've just joined a big organization, you're in a big organization, you're putting that out there, make sure that everybody knows, everybody understands, I joined in Q3, where am I? Are we in do? Are we in check? So the communication for that, how it's integrated into onboarding, how people learn how to be a part of your agency, et cetera, how it's integrated into your day-to-day practice, et cetera. All of that also has to be written out. It's written in policies, procedures. You make some choices there, and then you just follow those up. But this keeps the process going, and it gives you time to act. It gives you time to plan. It gives you thoughtful time. It gives you time to execute, and it makes sure that each of those are really feeding into the other piece of there, so that you're always on this continuous quality improvement loop, et cetera. So next slide, please. So quality assurance and compliance are continual. Not surprisingly, we've got another loop for here to think about it. These are some places where, each piece feeds into the other. And as the quality lead of your agency, you're going to be thinking about how that does. So it all starts with policy procedures. What have you written down that you said you were going to do, that Medicaid's going to, and the state's going to look at and say, you said you're going to do A, did you do A? It's all built in there. There should be a whole quality section in your policies and procedures that says, this is the activities that we're doing in regard to this is the schedule, this is who's doing them, and it's something that you can monitor yourself against as well. This is all integrated into staff training and supervision. So it's really important that every staff, while you may have a quality lead, it's important that every staff person throughout their agency knows what their place is, what their contribution is in order to building the quality services for your agency. So it's built into the regular trainings that your staff receive. It's built into supervision. It's built in the dialogue between supervisors and direct services staff in regard to what is it that we are building? What is it that we are creating here? How do we ensure quality? What did we hear in our last quality assurance reports? Quality improvement reports. What are we hearing from our participants, et cetera? All built into the regular process of staff training and supervision. I know there's a lot going on. I know a lot of times supervision gets lost, and just having that thoughtful space cannot tell you in direct service how important it is, how important it is to retaining employees, how important it is to growth for the individuals and their professional development, how it's important it is to your agency as well. And integrating quality into that regular supervision process, again, really important. Internal audits, external audits, you know when the external audits are happening. Bonica and other folks at Stacy are going to tell you. Again, as you put your annual schedule together, make sure that you're doing it internally. I've always heard from trainers, you always want to find any problems, you want to find them yourself before the external auditors do. So you want to find them, you want to build that corrective action plan. If the external folks find it, they're going to say, not okay, need a corrective action plan. You're going to say, yep, we found it a month or two ago. Here is that. That's really going to take you far with the audit process, et cetera. So build in some standardized, maybe you want to develop some tools that are developing regular actioning planning and enforcement. Again, these are just basic spreadsheets that say, okay, this is the issue that we were raised. These are the staff that were involved in that. And here's how we're building in, and here's how we're building in a process so that that doesn't happen again, so that we improve, et cetera. Think about where else and how else you integrate learning and improving, et cetera. Staffing, supervision, onboarding, training, these are all normal places. How do you bring the quality conversation into your staff meetings? How do you bring the quality conversation into your board meetings? How do you bring the quality conversation into places where all of these groups get together? How do you bring your quality conversation into hiring? How do you say to people, these are our standards, and if you're going to work here, this is where we need you to meet? So it's going to be just really, really important to think these through. This is a process that you're never done with. There is always room for improvement. We're always striving to do better by the people we serve and for the public sector benefits that we're offering. So next slide, please. Continuous. So outcomes planning. This is a little bit different. We want to separate out the outcomes conversation from, we had a compliance conversation, we had a quality conversation, now we're going to talk about outcomes. This is really how you communicate with your external stakeholders. Why are you here? What are you doing? What are the goals that your folks are trying to reach? What is the positive difference that you make for the people that you're serving and your community in general? And let's think about how you can collect a limited amount of data, because if you don't have resources for that, but how do you quantify that and make sure that you can tell your story from a data-based way, not just we're good people, we're doing good work. That's really, really important, but funders, outcome providers, working with the legislature, working with DHS, everybody's going to want to see those outcomes as well. So what are the real difference that you're making in the community? Why is it important that your services are here? And how do you get the data that helps you tell that story about why it's so important you're doing the work that you do? Next slide, please. So we're going to talk about outcomes planning. So a simple measurement outcome plan looks like this. What is your outcome measures? How are you measuring something? What's the calculation? How many people are you serving? How often are you serving them? What's the goal? What do you want to say? I mean, one of the things that I love in working in the homelessness field is it's really pretty simple. We're here to end homelessness. We're here to improve housing stability. That's a really nice, concrete, measurable goal. It's a little bit harder in the recovery space. People all have their own goals, but you're trying to build that out and trying to understand that. And then what's your data source? Where do you get the information on how this is done? We talked about surveys. We talked about focus groups. We talked about reporting here, et cetera. Some things of that can be drawn out from outcome measures for the outcome measure planning work as well. But that's going to be the person who looks at your analytical reports, your data and material, and says, how do I get this from these other sources? Or is there another data source that I need? So a simple outcome measurement plan says, these are our measures. These how we're calculating them. These are the goals we're trying to reach. Here's where we're getting that data. That all builds out to an outcomes report that says, here's the difference we've made. We've served 50 people this year. Only 1 or 2 of them went to the hospital. Only these, these folks are no longer homeless, etc. These folks are able to live with family again. How do you tell that story in a way that makes people think, wow, this is a really valuable service? It's really important that these folks are here doing that important work. So next slide, please. So an outcome measurement plan, I'm just going to take you through some examples of that plan. An outcome measure, percentage successful outcome, percentage of service participants are in the community without need of hospitalization for over a year. And you're going to want to look at that over time. You're going to have a baseline year 1, year 2, etc. Hopefully that number is going to go down. We want people not to be so ill that they need to be in the hospital. Percentage of service recipients who meet their community related goals. That's a way that while all of the people you're working with may have very different goals, you can roll that number up and say, and we helped people meet this many goals this year. Goals around recovery, goals around housing, goals around employment and related education, goals around community living, goals around family support and integration. All of those are different important goals that really tell the story of why your service is so valuable. We calculate it by doing the total number of participants who remain in the community without hospitalization divided by the total number. That gives us the percentage. We can say 60% of our people were never hospitalized, 80% of our people were never hospitalized, 40% of our people were never hospitalized. Last year, it was only 10%, and now we've gone to 40. These are the kind of conversations you want to have the data on to be able to show the change that you're making. You want to set a goal before you have that plan. So you know that you want to know your baseline and you want to see how you're going to improve. That's showing that you get the ideas around continuous quality improvement. There's always room for improvement here. And you've got internal data systems. You've got participant files. Maybe somebody pulls that data out of files, but you've got a plan for how you're going to capture that data. So that's going to build into your regular community reporting. Just an example, these are just high level, really broad examples. You may have more details, but you want to make it as simple as possible and as not burdensome on you and your team as possible. This is also, and we'll send you a link to this, example for quality supported housing of outcome measure plan, the outcome measure, the goal, the date, what was our result, and how you calculate this over time so that you've got this all built into a spreadsheet that will calculate these percentages for you, et cetera. So you can build that at the beginning of the year, relate it on your outcome measures. You can say, okay, our goal is 80% of folks not being hospitalized in a year. And then you can see, how did we do in relation to that goal? Then you can take the time when you're in the plan phase, if you're plan, act, study, do phase, model, et cetera, to say, okay, here's where we are in regard to our goals. We're doing good, we're not doing good, we've got room for improvement, what can we change? What have we heard from our participants? That really helps them stay out of the hospital. So again, these are all opportunities in order to be engaged with your participants, but also use the data that you get from that engagement in order to be able to tell the story of the value of your agency to potential funders, to the community, et cetera. Next slide, please. So this is an example of, again, these are just basic quality improvement tools. Again, just nice looking spreadsheets that you can download and adapt for your agency, et cetera. Again, they tell you what's the priority. Your agency sets the priorities as part of your strategic plan. Here's how you're going to do that, et cetera. Here's how you're going to pull it in. Here's how you're going to make that effort. Here's your strategy. Here's what your planned outcome is here. Here's who's responsible for it. Here's how the timing is, who's doing this at what time. And then finally, check. See, this is integrated in with the plan, act, study, do model in order to think through each of those. So something that you can begin to build out or adapt for your agency. Next slide, please. So we're going to go into breakout rooms for the next 20 minutes. What revisions to your agency's quality process? Now that you've learned all this, now that you've seen the tools and things you're going to have access to, what do we need to do? Maybe you haven't started, you're a new agency, you're just building your first quality plan. Maybe you already have a plan, that plan needs tweaks, but we want you to have time within, maybe you're somewhere in between there. We want you to have time within your agencies in order to think through what gets added to the work plan. Maybe you're not ready to work on quality yet, et cetera. Or maybe you're not, you're still in provider enrollment, you're getting people enrolled in services, but when you're going to have to think about quality soon enough, you're going to have to think about compliance, think about it from a timing perspective, think about it from a task perspective, and then also think about it from a who perspective. Whose role is thinking about quality and compliance in our agency, and when do they do that? We can't just add it on to one more person. So yeah, so let's spend about, let's see, let's go to 1 maybe 1:40. We'll give you a little more than 15 minutes here, et cetera, and have those conversations. So Hillary, I think I turn it to you because you can put people in breakout rooms, right, based on their emails? I know Leanne and her partner talks to,
Yep, I will go ahead and get those going. Give me 1 sec, please.
thanks, everybody. All right. We'll come back and ask you about what you talked about in your groups. Hey, everybody, welcome back. Hope everybody had a good breakout session. Hope folks were able to kind of take some of the material, begin to think about how does this relate to my agency? What do we have in place? What do we add? What do we add to our work plans? I'd love to hear from people. Folks come off and talk about the conversations that they had within their work groups and within their agency teams, and what new efforts your agency might be taking towards ensuring compliant and quality services. I see people. I see faces. Yay. Don't be shy. Whatever you're doing, I'm sure it can be helpful to other people on the teams as well.
I'm wondering too if anyone has any questions that came out. Maybe we don't necessarily have all the answers, especially for newer, or we haven't started any work yet. So I'm
Leanne?
wondering any questions about how to prioritize, or what should we do first, or what's most important.
So Leanne, they looked at the policy manual, they were creating an outcome survey, or throwing ideas out there, what they want to put in that survey. Thanks, Leanne.
Any other activities you guys were doing for those 20 minutes? Does everyone feel pretty good about how they evaluate their programs and practices for quality assurance? Maybe you guys have some advice for folks just get started if you're a little more seasoned, or encouragement. Maybe a great outcome that came about from a recent internal audit, or a change you made, and maybe feedback you got from clients as a result. Good stories too, not just scary stuff. I think when we think about like quality and assurance, everyone's worried about something happening to them and being afraid about that. But sometimes good things happen too, right?
I guess this is Heather. I guess for us, it was just a lot of continued conversation about how to integrate this service line into our existing CQI plan as an overall agency. So it was pretty easy for us to imagine
That's
how
great.
that would look. I think when we break out, spend a lot of time just really focused on the overall implementation plan and where we can see there are major hiccups, like, figuring out how to get this TheraP EVV system to communicate well with Evolve and manage billing and invoicing to providers and so forth, and payment to providers that are employed or contracted through our agency. So we're just working on a lot of those types of pieces. And I think, for example, had some discussion around, well, what would be required documentation for respite service? I mean, we're used to targeted case management, CPT codes, and we know exactly what kind of would, be expected in the case of an audit. I mean, respite care for this, if we're not the care coordinator, is it the simple start and end time that's tracked through EVV? Those types of things are where we're at.
Yep. Yeah, it's good. I think I keep a running list of these sorts of things. These may not be questions at that level of detail that we can answer in this training here, but it's really good for Monica and Jennifer to hear them and think about how does this get integrated into their standards development for all the services, including for respite care. How do you, because you want to know what you're being measured against so that you can prepare for that, et cetera. Is what I hear you saying, both for your, for people who are directly employed by your agency and for your contract. You have to think about it from your contracted staff as well. It's a really important angle.
Right, because there's just not that level of detail in
Yeah.
the current
Yeah.
state plan, which makes sense. Like we've never done
It's-
this before and we're learning as we go.
Exactly. Everybody is.
Yeah, Heather, that's a really good point, and I do hope that we can expand on documentation standards for each of the services. Just, how can we hold you as providers to a standard that we haven't even established yet? That's definitely something that I think about and we'll be working toward as we kind of start to see more of these services implemented.
Right. Nope, that's helpful, Monica. And so for us, as we're just trying to build like, for example, the training and support to unpaid caregivers out in our electronic health record, it's kind of like, what service entries do we need? How is it documented? Our contracted employees don't necessarily have access to our electronic health record. So what workers translates, how do we translate it into those types of things?
Yeah.
And we would just, I think without any other guideline, we would just kind of go with what we know is general expectation in other billing mechanisms.
Yep, absolutely. And I think we would look to those other billing mechanisms for examples too, as we're looking to build out what that looks like for 1915I. No sense recreating the wheel when we're looking at defining things more clearly and things like that. So I think you're right on with, do what you think is best and what you do for other programs and other billing mechanisms. And I think you're really going to be on the right track.
Sounds good. Thank you.
Yeah.
Okay. Yeah, that's partly why we started with what the state had already committed to the feds to do, because there isn't standard. We don't see standards there yet, et cetera. We know they've got to do these things. They promised the feds they would. But after that, Monica, I hear you. It's a development process and it's a building on what you see out there and where you see quality services with the positive outcomes you want to see. Yeah. Okay, next slide, please. Well, maybe we'll wrap this up. So this, again, our last regular session. Thank you all for joining us. We hope we'll still be working with you as we do other TA and efforts. We're working through Monica and Jennifer, so please feel free to reach out if we could be helpful in any way. Again, all the materials will be up there. We'll do the Q&A session on Friday. If you've got any questions about this, and we're working on getting Monica and team are working on getting the materials up, and then we're working on figuring out how we organize that direct TA. So if you have any specific needs, I really suggest you reach out to Monica and Jennifer and share how we might be able to help you, whether their help might be there. I think a big piece of our efforts next going, but Monica, change this if you will, is one, adapting those materials to make sure they're more broader than just looking at the housing support related services, getting another cohort of agencies through this training and through this process. And then also looking at how we support you different, looking at group TA models or individual TA models. Think about what would help you move your business and your process here forward. Feel free to let us know that, but most importantly, let Monica and Jennifer know that so we can make sure we're meeting your needs in the coming year as this program builds and grows. So yeah, Ambrosia, Jennifer, Monica, anything else you want to add before we close out?
I don't think so, other than thank you all so much for participating. And please don't be shy to reach out with questions or, if we can help you walk through things, talk through things, interpret the state plan amendment, anything like that. We're happy to do that for you.
We're grateful you're all up there doing the support and work in the community.
Congratulations, the first cohort of our Medicaid Academy this round. You hung in with us, and it was a privilege to start with you guys as you either branch out, do the work for the first time, or add onto your existing portfolio. We're excited to see what you guys do with this new resource. So thank you for taking this step.
Thanks, everybody, and we will be in touch.